Maybe. You probably. Hey, Amy.
Good afternoon, everyone. Let me try my microphone. Dr. Albright, can you hear me? Dr. Denchi, can you hear me? Please respond.
Dr. Arthur, I hear you, and this is Hannah Kwei.
Prof.
Yes, please, I can hear you. This is Dr. Denchi.
Good. Rabbi.
Yes, Doc, I can hear you. I'm here.
Fantastic.
Good.
Good afternoon. Good afternoon, everyone. It's a pleasant afternoon that we have today. Sorry. A pleasant afternoon. Again, a very good afternoon to all of you. I'm excited to see all of you once again. We are going to have a very interesting discussion. And so, by way of housekeeping rules, if you join us, please immediately put off your microphone, not to distract our facilitators and participants. We are going to discuss mental health. So again, I ask all of us to be sensitive in our remarks and questions. We are going to put in chats and ask questions and all that. Please be sensitive in your remarks and in your questions. Then again, when it gets to the question time, how we do it, you click on the question icon. So I see that your hand is up. I invite you and I unmute you, then you can make your submission. What are we discussing today? We are going to talk about students' mental health. Several epidemiological studies by various researchers have indicated to us that the first onset of mental health problems or mental health disorders starts between the ages of 14 to 24, 25. So a good look at this age tells us that these are our students, either in SHS or in the university, and it impacts on them. It affects their daily living, even going into adult age. It has an impact on them. We as parents, as teachers, we play a significant role in the development and in the support of mental health and well-being of these our children and our students. Then again, even treatment gaps, that has been indicated that now it ranges between 83 to 92. These are the people who are not well and are not receiving treatment. What percentage constitutes this age group is yet to be done in Ghanaian studies. But let me give you a few figures with regards to Ghana. Disease conditions for this particular age. For just this year alone, between January and October, this data was pulled out of the District Health General Health Information System. For schizophrenia, this year alone, female 667, male 623. Bipolar 152. That is female, male 140. General anxiety, female 248. Male 133, epilepsy 1,236 for female. For male, it increased to 1,353. Two of our known mental health advocates have indicated to us that they began having problems whilst they were in school. And for that matter, it is very important that we discuss this matter. But the question that asks is that, didn't their friends, their family, staff notice any changes for them to recognize that they are having mental health issues, and for that matter, what they could do to support them? Or they were even reluctant to talk about it, so they left them to be. In the media, we've heard stories about suicide, students dying by suicide. A whole lot of things are happening to our students. I don't want to talk about what, because our facilitators are going to do that. This is just a preamble. And for that matter, today we are going to look at students' life and mental health. We need to resource our staff, our parents, so that they'll be able to have that strategies they would use to avert a crisis. So the topic specifically, student life and mental health, assisting parents and staff with contemporary strategies to avert a crisis. This is what we are going to do. And we have some seasoned facilitators in terms of academia, in terms of practice. So they're doing their stuff and they are going to help us digest this issue. Let me see. Rabbi, can you hear me?
Yeah, I can hear you, Doc.
So you are most welcome here.
Thank you.
Your initial comments. I want to introduce all my facilitators to my participants. So your initial comments.
Doc, once again, thank you very much, and good afternoon to our listeners and presenters. I think to me, this webinar is apt because here at KNUST we are getting a lot of cases of late. Myself, as I stand here, I'm scared in the next 10 years. If you don't do something now, I wonder the kind of youth or children or people you're going to handle in the next 10 years. So to me, I think the webinar is apt. My worry is that how many people are listening to us? How are you going to get to the masses? That is my issue. But I hope those of us who get the information will be able to spread it so that at least at the end of the day, we can make the impact we really want to make So once again, I think thank you very much for putting up this program. Yeah.
Thank you very much, Rabbi.
Thank
Doctor,
you.
okay, thank you. Dr. Lydia
Yes, Doc.
Denchi, you are most welcome. Good afternoon. A few words, then we go on. I'll introduce you properly.
It's okay. Good afternoon, Doc. So mental health is an issue of concern, and I think it's a laudable idea that we meet as people in the area to talk and discuss about it. So like you rightly said, why do we wait for it to get to the crisis stage? Didn't anybody notice? So we wait and then like suicidal stages, and then people are like, the person said this, the person said that. So it's important that we meet and then pay attention to some of these little signs that we may be able to survey the situation before it gets to crisis stage. So mental health issues are very important to discuss. This will be my initial comment.
Thank you very much. Professor Akwe, Professor Hannah Akwe, can you hear me?
Yes, I can.
Hello there.
Hello.
You are most welcome.
Thank you.
Your initial comments. I'll introduce you properly when you're about to do your presentation.
Sure. So I'm glad we are all here. I believe we get to talk about things that probably historically we kept under wraps, but the more we talk about it, the more we find solutions to help ourselves and the people in our homes, as well as the people in our workplaces and in our schools. It's a joy to be here with all of you. Thank you.
Thank you. Our final facilitator, Dr. Johnny Ando, will join us along the line. He's caught up somewhere. So we will start. And luckily for us, he's the last presenter, so there isn't cause for alarm. But I have one of my usual presenters, facilitators, Dr. Albright. Can you hear me? Oh, he just logged on. He can hear me.
You put me on the spot.
Good. Don't go far. Don't go far. Don't go far. It's good that I know that you are there. It's good that I know that you are there. So don't go far.
Thank you.
All right. So, ladies and gentlemen, we'll just kick the ball rolling. Mr. Rabbi Darko will start the presentation for us. He will talk about what are the common stresses of mental health issues facing students. A straightforward question, and he will make it as simple as it can be for us, parents and tutors and everybody, so that we would know some of these things. So Rabbi is a psychologist, and he's at the KNUST Counseling Center. He's a psychologist, and he's at the KNUST Counseling Center. So interacting with students and knowing their problems, he has them on his fingertips. So Rabbi, the floor is yours. Our participants are eagerly waiting. And my fellow participants, in fact, today you are asking the questions. So I'm not asking any question. I may ask one question or two, but I'm leaving it to you because this is a very critical matter. Our participants will come 52 now. I'm leaving the question to you. You would ask your question. So note them down. You can type them in the chat box, and I'll read them as we go along.
Thank you very much, Doc. Am I permitted to share my screen?
Yes. Let me. Yes, since you are a co-host, feel free to do that.
Okay. Okay, please, I hope we all can see.
Yeah, it's clear. So
Good. Thank you.
We try as much as possible to be within the time.
Okay, 15 minutes. 15 minutes, I guess.
Yes.
Okay. Okay, thank you very much, Doug. So I'm going to work on or talk on what are the common stresses of mental health issues among students, as you did rightly say, Doug. Okay. Excuse me. So, okay, we can now go. Good. So good. I'll start with this. Student life can be rewarding and challenging. Where they are trying to learn some personal stuff. That is a period they want to grow personally, a period they would want to explore life, friends, relationship. It's a period of exploration and learning as well. So it can also bring about a lot of stresses in their pursuit of trying to grow personally and explore the environment. It comes with a lot of challenges. And these challenges in this context can be stresses. We call it stresses, yes. Let's look globally. WHO did a study in 2019. They said that globally, there are 14.7 adolescents having some form of mental health challenges, and 14.1 who are young adults, same, and about 14.9% who are in their middle age or who are middle adults are suffering from some sense of or some level of mental health conditions. And prioritizing youth mental health is important as early onsets. Mental health condition may link to mental health issues. As Sigmund Freud rightly said, those of us who are familiar with Sigmund Freud said, childhood experiences can easily lead to adult lifestyle, or can impact adulthood lifestyle. I think Doug has given us the statistics in Ghana. I think the one Doug gave to us, one. What I had was a report by Ghana WHO Special Initiative for Mental Health. The report they did in 2022, they were saying that within Ghana, the young adults ranging from 20 to 29 display higher prevalence of some mental health conditions. And all these things give us the red light that our youth are going through a lot of issues. And you realize that most of them at that time, adolescent period, are in school. Therefore, it is pertinent for all of us, so important for all of us to have deep issues or deep understanding about mental health. I normally start my presentation with this thing. I call it the wheel of the student life. This is a conceptual framework of the whole presentation I'm about doing. So the student is the middle, as all of us can see, and this student is surrounded with a plethora of issues. Mostly what parents do is that they tell the children, is it good I share my video? Okay, I think I can bring my video up. Yeah, good. This is what the parent normally tells students. It is my duty for you, it is my duty to pay your fees, to make the provision, but yours is to do the studies. Forgetting that it is not only studies that the student is going to engage. There's a lot of things that will find the student within that period. I perfectly remember about 3 years ago, a student came to my office, a beautiful girl, dressed well, entered my office and told me, say, I have an issue. I said, yes, that is why I'm here. My ears are yours. In fact, it took the student about 30 minutes to talk. I applied all the therapeutic skills, created a therapeutic environment, did everything for the student to talk. Then later, about 45 minutes, he said, sir, I will talk. And I said, okay, yes, my ears are yours. Then he said, sir, I am a witch. Immediately she said that, I sat well. So, wow. I wanted to probe further to find out who made her believe that she's a witch. So I decided to do a little probing. Then he said, sir, please don't go there. Do not go there. I'm 23 years. I'm old enough. I even knew where I went yesterday night. In fact, I was really shocked. And this is a student who is trying to learn, study. And according to her, this witchcraft thing is impeding her studies. And she can't focus. And she's so disturbed. She wants to work like a normal student on campus. So the students we see out there are faced with a lot of challenges. Some of them, their parents are not aware. unfortunately. Now I'm going straight to the common stresses students normally face, and I'll add a lot of experiences, what I have seen. The first one is academic expectation. They are in school. Their main purpose in school is to get a degree, to get a certificate, and become who they want to become. Ideally, some of these students are high-achieving students. Naturally, they want to get to the first class without no one pushing them. They just want to be there. They just want to get all the A's. So when they are not getting the A, that alone can be a toll on them. They have that instinct to perform very well. And if they are not getting, they are not okay. And that alone can stress them. It can affect their mental health. Some of them, they were doing very well in junior high schools. Now, in their junior high school, now they are in senior high school, and they are getting a lot of competitors. That alone, the competition they are getting alone will stress them up. It can affect their mental health. Again, there are some, you know, the pressure in the class. Everybody, a student came to me and said, "Say, I'm very, very good, but he's doing doing medicine here. But anytime I start to get up to talk, the words, the comments people make, I'm scared. So say I'm unable to talk." So the competition in the environment, sometimes the comments some of their classmates will make can pour cold water on them. I call this, the third one, puppet phenomenon or parental pressure. It will surprise some of us that there are a lot of parents who have brought their children to school for their, should I want to use the word selfish interest, as in for their own pleasure. Let me put it that way. About, I think last 2 years, a man came to my office around 65 years. In fact, he cried his heart out in my office. He cried for about 40 minutes. And this is his issue. His son has completed senior high school. Apparently, the man and the wife, they've separated, and the boy is with the mother. So when the boy completed, the mother and the uncle of the boy convinced the boy to get to one of these, I think, immigration service. And the boy went, and the father got to know that the boy has gone and wasn't happy, wanting the child to come to KNUST Tech or the university. So when the man came, probing, the man said, "Sir, what am I going to tell my friends?" Not knowing the man has a group of friends, and their aim is that all their children should go to the university, or I don't know, and that he has told the boy that if the boy comes to the university, every month, aside the monthly money he will give it to him, he also give him additional about 5,000 or so. He has the money. So he wants his son to be in the university so that at least he can boast. He can tell his friends that my son is also in the university. That's all. I had an MPhil student who, at the time, when they called me, has locked herself in the room for 3 days. Didn't want to come out. All effort to bring her out failed. She didn't want to come out. The only thing they got to know that she was alive was that her brother was in the same hostel, and she used to tell the brother that I'm fine. That's all. So they asked me to come in. I went to the room, not for about 15 minutes. This lady didn't talk, didn't respond. Then I decided to go back to talk to speak to the school authority so that at least they can use a little pressure or force. Then I changed my mind and I spoke to her through the windows for about 7 minutes. After speaking to, I just understood her, just saying a lot of things to let her come. After the 7-minute stop, still nothing was happening. So I decided to walk out. Then I heard a noise at the door. Then I realized that something is about to happen. She wanted to come out. Yes, she came out. And you could realize that there was a lot of weird scent coming from her. It was really sad. I managed to bring her to my room, my office, and the first time in 3 days, she ate Gary and peas in my office. Good news. So I made her to talk, or she started talking. And this girl was so intelligent. She managed to start from KG2, mention all her friends. And it appears that she has become a puppet in the hands of the parent. Even the program she's doing now, she doesn't like it. She was forced to do that. And she's gotten to a point that she's stuck. The BCBNC, I am tired, say. So that is why she has locked herself. So parental pressure is causing a lot of mental health issues among our youth. They want the children to be somewhere so that at least they can be at the comfort zone of their place or their houses or where they are to brag. Good. Next one is financial difficulties. Yet obviously Chan et al. Did mention or did indicate that economic downturns are associated with increased suicidal rates. And of course, it's true. They also increase the rates of depression and anxiety. And here in KNUST, we decided to do a little study or try to correlate the data on reasons why students come for counseling. And as you can see the blue, you realize that for the past 3 years, most of them are financial issues. Some of them they come for a semester and they go back. Why? Because of financial issues. Some what to even eat is a challenge for them. One student from the north said, here at the north, we are used to soup. But here still I'm unable to eat food with soup. So what I do, and I don't have the money. So when my friends cook rice, what I do, I beg them to get oil. So I heat the oil and I splash the oil on the rice, then I eat. So that's what she has been eating for the past 1 month. Financial burden has been one of the major issues causing mental health issues among our students here. And all of us can attest to the fact in our current situation. General adjustment is one of the major issues. Especially those in first years, they are transitioning. They have moved from secondary school where they are being controlled to where more or less the freedom is so wide. So adjusting to the new environment can be a very big problem. A student came to my office the last time and said, it appears the first year, the system is running too fast. I can't lecture. From lecture, you go to room, your roommate are disturbing you. Sometimes the lights are on, instead of me to sleep, the lights are on, the internet and all, the top sometimes are not flowing. Say, I can't go on, say, I am tired. So when I did a little probing, you realize that this girl is coming from a big, a rich home. And she's unable to situate herself in a system here. So adjustment is one of the major issues. Mode of teaching from JHS to SS can be a challenge. JHS, mostly they write the notes on board for them. And in senior high school, they detect. So that alone, some of them are not able to do the spelling, are unable to write and write very well, and can be a challenge. And here, lecture method. Sometimes they tell them, go online and do research. How to even use the PC becomes a problem. So that adjustment, that swift change can cause a lot of mental health issues, and it is causing more havoc among our youth. Roommate issues, how to relate very well. So every now and then we are getting issues about roommates. When the lights are supposed to go off, she has used my plate. He was not supposed to sit on my bed. Some of them have personal issues, and it hasn't been easy at all. Some of them are unable to adjust. Financial adjustment. Here, your money is given to, let's say, monthly or let's say a semester. How to manage your money? Because here you are managing everything yourself. Has also been a challenge among our students. Social life relationship, so important. There's a new environment, the tertiary or senior high school, the new environment for you to create friendship and connections. How to even choose the best friend, whom to choose as a friend. And sometimes some of them would want to test relationship. Whom should I go out with? Becomes a challenge. And sometimes when they succeed, they have uncontrollable sexual intercourse. A lady came to my office the last, it was so painful. This guy sleeps with her almost every day. Almost every day. And the lady's telling me, but it appears I love him. You see? And that's my first guy. They see things differently. So relationship has been one of the major issues of, has been one of the mental health issues among these students, relationship. Dealing with breakups, when they get into it, the side of the coin is breakup. And how to even deal with the breakup, it's another thing. One night around 2 a.m., I was asleep. I was in my bedroom. I was charging my phone at the hall, and I had a call twice. Then I realized it was an emergency, so I went to pick the call. Whilst I was picking the call cut. Then I realized the same number has texted me a message. So I went to my message and I realized this student has tested, I can't sleep about 50 times. I can't sleep about 50 times. I said, wow. So when I called, it was this nice voice speaking to me, crying all over. Then I calmed her down and I asked her to see me in my office the next day. So the following day, frankly speaking, I forgot. I was there, they asked that I was told the lady wants to see me. This beautiful girl, And she was shivering, so shivering. So immediately I saw her, I said, oh no, but you could see that we have to send her to the hospital. Let's make arrangement for the driver. She shook her head, anticipating no, or saying no. So she sat in my office, everybody went out, and I asked her, what is the problem? And she said, she called me yesterday. I said, okay, I remember, sorry, I didn't call you. What is it? The issue is that when she came to school, that was the first boyfriend she had, taken. And the boy said, since she's not sleeping with him, she's leaving him. And that alone is causing her to wanting to commit suicide. That was when I realized another symptom, or I saw another symptom of broken heart, that is shaking. So in our practice, when you realize that somebody is shaking, please, we shouldn't just rush and tell the person to go to the hospital. For all you know, it's broken heart. So probing further, this student said when the issue happened, she went through her contact. When they come to first year, we give them list of counselors, name contact of counselors. When the issue happened, to her, she realized that it wasn't necessary for her to call anybody, because what she was going through, nobody will understand her. Because she's smart. I've come to school to study. I can't tell this to my parents. What would they tell me? I've come to school to study. I've engaged myself in boyfriend relationship thing. The boy has left me, and I feel like killing myself. So whom should I explain this to? So he said she decided to commit suicide, and she remembered she had contact. And the contact, we have some local names. So she says she called Rabbi because she realized that name Rabbi might be Obroni, a white person. And for white person, he will understand issues. These are first year people, first year students. So she called my number because she thought I was Obroni and I would understand her. Fact track, in third year, she came to me and I asked, so would you have been happy to kill yourself? She said, that would have been the worst thing I had done to myself. So you see, breakup. So most of them are dying because they realize that when you die, you are not coming back to see the problem again. Social anxiety. There was this girl who came from Sefi, academically good, but unable to speak very well. According to this girl, she said, she made a comment on their classroom platform, and she made a mistake. She didn't write the English well. Oh, come and see. Other student bombarding her with insults. Where did you school? These students, the way they joke. And this thing had a toll on this girl. She came to me shaking. She said, I want to go back. I want to stop schooling. I knew it. I was told that since I can't speak English, I can't come to KN Westy. In fact, it wasn't easy. It took about 3 months for this girl to become okay. And sometimes the social life on campus alone can lead some of them to be isolated. Since this student can't talk in public, what do they have to do? They have to keep everything to themselves, and hardly will you see them engaging others. So social life and relationship can be one of the major issues. Addiction. Now, students are doing all sorts of things. It surprises us. I think all of us are in mental health. Some of them, as we stand now, are taking in dry feces. Dry feces, and it's so severe, and they're addicted to this thing. And we should realize that this addiction thing can be a cause and at the same time a consequence of mental health. Betting, I don't know whether mental health authority can do something about this. This betting, it is causing more havoc among our youth. If you relate with them, you understand this betting is health disturbing them. Really, really disturbing them. A student came to my office, was crying all over the place. Just said I was giving 2,000 cedis to buy a mobile phone for myself and my sister. I've used that money to bet, hoping that if I use my sister when I can get the money, him I didn't get, and I was forced to steal at one of the halls. But unfortunately, the cameras caught him, and a laptop that cost over 3,500. He went to sell it at 800 Ghana cedis. He was arrested. Look at this. He says, say, I can see I am changing, all because of betting. Masturbation. A student started my office, say, I want to cut my manhood off. Now, I've realized that every 3 male student come to my office, 1 or 2 is suffering from masturbation. And this thing, they are unable to tell their parents. They are unable to tell anybody. And even we, the counselors here, sometimes it takes time for them to speak to us. It is really disturbing them, addiction, masturbation, and internet. Now, most of them, they studied with their slides. And whilst they are studying, you see this pop up, the notification. According to most of the students, it's really disturbed them. And if they do not use mobile phone or internet, they can't be okay. So they are addicted to that, and it's causing a lot of challenge for them. Identity and self-discovery. This is where they are learning that there's a period they are learning more about themselves. Who am I? What is my purpose? Some of them really don't know what they want to do. So this is the period they would want to find something to win after school. And that alone can be emotionally taxing. Should I do this? Should I do that? Who really am I? Who am I? Sometimes they get conflicting definitions from people about who they are. A young guy during the COVID season said, if you remember during the COVID season, that was when the LGBT case came in Ghana, where there was a lot of interactions. And this guy said the mother heard the news. I think the father is late, and he is the only son of the mother. As a matter of fact, the holy child of the mother. And the mother is a deaconess. And whilst they were listening to radio, one time the mother got up and was just crying. Said, "Oh, what is really happening on earth? How come a male will develop affection for another male?" The mother was all over the place cursing these people and a whole lot of them. After cursing and praying against all of them, she came back to the son and said, "Son, you are my only child. Please, when you go to school, and some of these people come to you, please run away from them. They are evil people. They have bad spirit." So this guy came and said, after my mother saying this, I have not been able to sleep. Say, I am one. And as it stands now, we are 3 in a room. I have started developing affection for the other guy. Say, I'm unable to stop. Say, if there is a medication, if there is a medicine for me to take this thing for me, please show me. I need help because I do not want to disappoint my mother. She's the only person I have. You see this person? Self-identity. Who is he? Having a toll out there. And a lot of students are in the same situations. I really don't know what is happening among our case of late.
Papa, if you can fast track your presentation, it's exciting that we need to get this background, but you've exceeded your time.
I'm almost done.
So if you can wrap it up for me, I'll be excited.
I'm almost done. The next one is
resilient.
Most of them are not resilient enough. The little pressure, they just want to give up. A little pressure. Multitasking is a challenge for them. And then last one, time management. The university education, the freedom is wide. And most of them are not able to know when to go for religious activities. How to balance it's really a challenge for them. So that one alone is also bringing most of them down. Has become an albatross on their neck. And some of them are good. They end up not doing well because of the competing variables that are fighting or that are, fighting the academic performance. And at the end of the day, they become victim. So basically that's time management is also a challenge for them. So these are my references, and thank you very much for your audience. I'm grateful. Thank you, though.
Thank you. Ladies and gentlemen, please give me just a minute to make a call. I've been notified of a technical issue and I need to address that so that others can join. Thank you. Just a minute, I'll be with you shortly. Yeah, sorry, I'm back now. Dr. Rabbi, so if you can take, yes, thank you very much. That was a wonderful presentation. I mean, these are very little things that we take for granted, that we think that, oh, it's nothing. But when you listen to the real life experiences that Rabbi shared with us, then it means that we need to be worried of these things and we need to take care of them. Academic expectation, financial difficulties, social life and relationships, addiction, identity, self-discovery, and lack of resilience, including time management. These are issues that confront our students, confront our children, and they need help. Well, let's get Dr. Lydia Afremia-Denchi to tell us, how would a parent or staff recognize a ward experiencing mental health difficulties? These stresses that the students go through push them to experiencing mental health difficulties. And how would we recognize that? Dr. Lydia Afremia-Denchi, the floor is yours.
Thank you very much. So like Doc rightly said, we want to see how we can recognize. If I say we are talking about parents and then administrators and counselors in the schools, because we are talking about ward and then we are talking about students. So how we can recognize students or wards who are experiencing some of these things. And from the presentation of Dr. Rabal, some of these things are the common things we see with them. So we want to look at them and then see how we can pay attention to each of them so that we can help save the situation before it gets out of hand. So mental health, as most of us are aware, is defined as a state of well-being that allow individuals to be able to cope with normal life, in a midst of stress. So yes, and still remain productive. The World Health Organization also defines mental health as a health state that an individual, of which an individual realizes his or her own potential, and like I said, is able to cope with normal stress. So like we usually say, we need stress. A little of it is okay for a normal. And to remain productive and fruitful is what is called a mental health. But as soon as there are challenges with this, as the individuals that are not able to perform well or are not able to be, the individual is not being productive, is not being fruitful, is not able to go on with normal everyday activities, then we suspect a mental health difficulty. So mental health disorders encompasses a wide range of conditions that affect the thoughts, that affect our behavior.
Dr. Denchi, she is back.
No, no,
Sorry,
Baba. It seems the line dropped.
Hi. So we want to look at some of the
Baba.
significant. We want, hello. we want to look at some of the changes in behavior. So if we look at some of the physical signs, we look at a change in patterns of sleep. So sometimes these are things we see, but probably, like I said, we do not pay much attention to them. So now that it has come forward for us to discuss, we need to take note and pay much attention to them. So you realize that the individual, there's a change in the sleep patterns. So it's either the individual is sleeping too much or the individual is sleeping, so just 2 hours sleep and the person is up and cannot sleep again. And changes in appetite. So, and then the weight, changes in weight. It's either the individual is gaining excessive weight or the individual is losing weight. All these are visible signs. Sometimes visible signs like distress, where they have headache and stomach aches. Not all the time, but sometimes it can also be a mental health difficulty. So we have to be on our guard. Then social withdrawal. Students usually would want to socialize, be in the company of other students, be in the company of their friends. But as soon as we realize that they are withdrawing from the companies that they usually would want to be, so they want to avoid social interaction, they are not interested in any social activity that they once enjoyed. So please, we have to take note of the things that they once enjoyed, the social activities they once enjoyed. They are no more interested. So if it's about going out to see friends, now they don't want to do that again. Then we realize that there's a need to pay attention. Difficulty concentrating. So they struggle to focus. They lose interest in schoolwork. So if it's an assignment, they lose interest in doing it. So you want to find out why would somebody be in the university, in the SHS, they have given an assignment, you are in the boarding house, you are not occupied with any other choice, and yet they will not do the assignment. All these things should not be treated like the student is being stubborn or something. Most of the times we only conclude that they are being stubborn. They don't want to do the assignment, but sometimes it could be as a result of a mental health challenge. Again, emotional outbursts, excessive what, the little thing they are worried, the little thing they are panicking. And then sometimes changes in appearance. So personal hygiene, you know that usually this category of students, like Dr. Atta mentioned, we are looking at 14 years to 25 years. And these are people at this stage, they are much, they pay much attention to their physical outlook. Especially the females, they want to look nice, they want to be well kept. But when it happens that they don't care about how they look, they are so unkept, and their hair, especially the ladies, sometimes their hair can be on for a long time and they are not paying attention to it. These signs, we cannot overlook them. We have to pay attention to them as parents and as teachers or lecturers in the classroom or as counselors. Sometimes they engage in risk-taking behavior. When Dr. Rabba was presenting, he said abuse can be a consequences. So there are some of the symptoms that you look for. So they abuse drugs, they can start drinking, things they were not doing. If they are driving, they can be reckless, unnecessary overtaking, and all those things can be as a result of a mental difficulty they are going through. It's a sign that all is not well. There are some psychological disorganization somewhere. Then sometimes verbal clues. So you realize that the statistics says that suicidal statistics says that in 5 people, you get one who knows somebody who has heard about somebody who wanted to commit suicide. So then after the incident, they begin to, oh, he said this, he said that, he was doing this. So these are verbal cues that we don't pay attention to. They directly express what they are going through, the distress, the sadness, the anxiety, the hopelessness they are going through. They verbally disclose them. So we have to pay attention to these verbal clues too. Academic changes. Again, we could have brilliant students who will have now their CGPA will be suffering. Their grades now will be going down. And these are academic challenges. So we should not be quick to associate it to the fact that they are now playing around. They are chasing, if they are females, they are chasing boys. If they are boys, they are chasing girls here and there. It could be a mental health difficulty. Then sometimes they seek attention. They need unnecessary attention. These are some coping mechanisms that some of them do adapt. So they want all the attention. So they will do all to get the attention of their parents or their mother. All this, the way we act, the way we go about our things, the way we talk, the way we behave, are all personality. So what is typical of us is our individual personality. But when our personality, that is what is typical of us, is being distorted, there is a dislocation or a disorder, it can also be a sign that we are going through a mental health issue. So for example, a dislocation or a personality disorder like depression can also mean that the individual is going through some mental health difficulties. For example, when we see signs like persistent feeling of sadness and hopelessness, they feel empty, existential vacuum. They are not finding meaning in their existence. You know, it's like everything has come to an end and you don't even know why you live. Then there's a sudden loss of interest in everyday activities, especially the ones they have enjoyed. They change in appetite, which can result in weight.
Dr. Renchi, please
Yes,
hold
please.
on. Are you sharing your slides or
Hello?
you are not? Are you sharing your slides? Are you sharing your slides for us to see, or you are now giving a verbal presentation?
Hello, Doc. Please, any problem?
I'm saying that, are you sharing, are we supposed to see your slides?
Doc.
Can you hear me? I'm saying, are we supposed to see your slides?
Hello, Doc.
Hello, Dr. Renchi.
He's experiencing a network challenge.
Hello.
Yes, I can hear you now. Please go ahead. I was asking you if you are sharing your slides, please. But go ahead. Go ahead.
Yes, please. Was I not sharing?
No,
please, was I not sharing?
No, I think you took it off.
Oh, sorry. Oh, sorry about that. Please, am I sharing now?
It has started to appear. Okay, it has appeared now.
Please, so please, sorry about that. I didn't know. So all that I'm saying is that each individual has a personality, and our personality is the way we act, the way we behave, the way we think, and the way we go about our normal everyday activity. What is typical of us is our personality. As soon as there's a dislocation, there is a disorder, there's a deviation, then it becomes a disorder. It becomes a sign that we have to look out for mental health difficulties. So I was talking about some dislocations like depression, where we have persistent feeling of sadness. The individual is experiencing as like there's an emptiness. Don't find meaning in your existence. Everything is meaningless. You don't even know why you are living. This is a sign that the individual might be going through some mental health difficulties. Again, the individual may lose interest in activities they have enjoyed, they have once enjoyed. Then changes in appetite, which can result in loss of weight, or sometimes the change in appetite, sometimes some of them can eat too much, or we'll talk about eating disorder as one of the dislocations. Then sleep disturbances, either the individual is sleeping too much. So if we are parents, we have to watch out for these signs. When children are sleeping too much than usual, we should not conclude by saying they are becoming lazy. It is a sign to look out for mental health challenges. Some of them are oversleeping. Some of them are also not able to sleep. They sleep 2 hours, 3 hours, and they're up. They can't sleep again. Then they don't also know, it's not because they are working, they don't know what they are supposed to do. Then they also lose energy. These are signs we have to look out for in our students and then in our wards. Difficulty concentrating are also some of the things we have to look at for. Sometimes they are not able to make decisions. Simple decisions they are supposed to make, they can't make it. It isn't that they are thinking about what to say. They just can't figure out what to do. These are signs that we have to look out for. Like I said, these are signs that we usually ignore. It is all we don't see, but we ignore them. This simple thing, you have to make a decision and you can't make a decision. And then we conclude. These are signs that the individual is going through some mental health difficulties. Then sometimes they think about death. Like I said, when they experience existential doubt, then they think about committing suicide. There's a feedback. If they don't find any meaning in their existence, think that, so what is the essence of my living? It's better I end it. So they think about suicide. So a dislocation like anxiety disorder, when people worry excessively and then they panic. So the little things they do not fear, cockroach. Some usually naturally fear it. I'm talking about things that are not usually part of our personality. So now, even when cockroach pass, the individual doesn't even know what to do. The whole world has come to an end. Then obsessive thoughts and compulsive behavior. So you see that the individual experience some unwanted thoughts. And the worrying thing about it is that they cannot control it and it's recurring. And they have that urge to act on whatever unwanted thought that is occurring. So sometimes the thought that jump this, and then it's recurring, and there's that urge, that compulsion to act on that recurring thought. Then there are sleeping, like I have said. Then schizophrenia, like a doc said earlier on, which has symptoms like dismissing. The false belief, they believe things they believe in. The things do not exist, and yet they believe in. So this can also result in mood swings. So nothing is so excited, yet they are happy because they have false beliefs. Then sometimes they can hallucinate. They can hear things that do not exist. And then they can respond to these things that they are hearing, which do not exist. Sometimes when it happens like that, we don't have to overlook it, but we have to pay attention. Then disorganized thinking or speech. So you are conversing. They pick here, they talk about relationship, and now they go and talk about academic, and then you can't pinpoint, you can't really organize the conversation. You don't really know what they want to say. We have to watch out for mental health difficulties. Social withdrawal, like I've said, we have to watch out for mental health difficulties. Then sometimes they're eating disorder. So it's either they are restricting their intake of food, or they binge eating. They can eat excess for 2 hours they are eating. And then it distorts their body image. So sometimes you realize that the individual is losing weight. It could be a mental health issue. The individual is gaining weight rapidly. It could also be a mental health issue because their eating pattern has changed. Then we can also have attention deficit disorder. This attention deficit disorder can happen to the JHS, the senior high, and even the secondary, the university students that we teach. Difficulty paying attention and then focusing on a task. So the lecturer is lecturing and they can't, as old as they are, they can't concentrate. They cannot just concentrate on anything that is going on in the lecture hall or in the classroom. And then they easily forget. I always say that forgetfulness is just a gift from God. What would have happened to us if we remember all the things that had happened to us right from infancy? But then the things that you should remember. So there's this phone in my right hand and I'm still looking for it. We crack jokes over it and then we laugh over it. It's a serious issue to look at. So you just put the water here, you cited it and still you are forgetting that you are the one that placed it there and we are looking for it. These are signs that we have to look for. It is important for us to know that some of these signs that I've spoken about, it is not that we do not see, we do, but we do not pay attention to them. Like the mood swings, some of them are not interested in a relationship, a relationship they were going through. Some of them, the academics is going down, deteriorating, yet they don't care about it. There was this student that I thought that they just ended semester. After quiz one, I was looking for students that didn't perform well. Then this student had 0.8/20. So under normal circumstances, the students should rather be looking for you because they are concerned about their grade and their CGPA. But the student, I was rather looking for the student, and a colleague were telling me that he was in lecture, though I said after lecture he should see me. And the colleagues were telling me that he will not come because it has happened this semester. It appears he's not performing well, and all the lecturers that are chasing him, he will just run away from the lectures and will not see them. So the students or the mates were playing about it, but as a counselor, it was not a plaything for me. How can a grown-up like that who will be failing in their exam, and yet when they are asked to come and see the lecturer, says I will not come, and we look at it like the student is stubborn or so? Like I said, these are signs that we usually see, but we do not pay attention to them, but they all constitute signs of mental health disorder. Somebody is oversleeping and we think that the person is just lazy. Somebody is overeating and we think that now they like food. They just released WASI results, the placement that just came. A parent was telling me that their child did not get the preferred school, and the child has been placed somewhere, and the parents are crying all over, stressed up, and this child has resulted in eating. So the mother is like, he doesn't care. As for the child doesn't care, but no, it is a sign of a mental health disorder. The child is not able to cope with the normal stress, but we are looking at it like the child doesn't care. The child is opening the fridge every now and then, drinking anything he finds in it, eating, and the mother thinks that now that you have not been placed in your preferred school, instead of you being quiet and reserved, you are all over the place and you are eating as if you are happy. No, so this is what I want to bring across, that these are signs that we usually see, but we do not pay attention. We attribute them to certain things and we do not consider them as mental health issues. I want to end by saying that it is important to know that experiencing some of the symptoms that I have listed does not mean that the person is suffering from a mental health difficulty, but usually these are some of the signs, but there could be signs of other medical conditions. So to diagnose a mental health condition is the duty of a mental health professional. We need to seek help from the mental health professional. If we identify some of these signs, speak to counselors, speak to psychologists, and speak to mental health professionals for assistance. Thank you very much. This is the end of my presentation.
Thank you very much. Thank you very much, Dr. Lydia Afremia-Denchi. Ladies and gentlemen, Dr. Lydia Afremia-Denchi is the head of the counseling unit at the College of Education, University of Cape Coast. She's the head of counseling unit, College of Distance Education at the University of Cape Coast. That was a brilliant presentation. In fact, talked about depression, anxiety, ADHD, schizophrenia, and all that. Bottom line is that when you find that there has been persistent changes in the thoughts, behavior, and expression of feelings of the individual, there is a reason to worry and you need to take steps. At this point, let me read some of the charts that has been presented in the chat box. Let me read a few of them, then we can. Well, very insightful. Thank you, Dr. Rabbi. Please, the slides are not showing up. Dr. Dame, very educative seminar. Very important observations. Thank you, Dr. Lydia. Thank you very much, Dr. Denchi, for the wonderful presentation. Thank you very much, ma'am. Thank you very much. We are very grateful. All these are commendations of the presentations that Rabbi and Dr. Denchi have done. So at this point, we go to our third presentation. That will be done by Professor Hannah Akwe. Currently, she's a managing partner at Nexus Integrate Limited, a company focused on using empirically supported treatments to support corporate and faith-based organizations, individuals, family, towards intra and interpersonal wholeness. She is also currently the lead facilitator on a Ministry of Education and UNICEF project developing guidance and counseling policy for Ghana. She is a licensed professional psychologist with the Ghana Psychology Council, a member of the Psychological Association, as well as a member of the American Psychological Association. Ladies and gentlemen, Professor Akwe is going to present on the practical strategies that a parent can take to help a ward or a student in a mental health situation. Professor Akwe,
thank you.
Ready for you.
Can you see my screen?
Yes.
Okay.
I can see your screen.
All right. So I'm glad about what Dr. Dakwa and Dr. Denchi talked about. They walked us through what many of us in learning institutions go through. I know Dr. Arthur pegged the age gap from 14 upwards. I may go down a bit because I work a lot with children, so I want to look at multiple developmental stages and how we can help each other seek for the support that they need. One thing I want us to realize is it's normal for people to go through stress because of changing life seasons. And so I go to a new school, I have to get to know people like Dr. Denchi was talking about. I think Rabi also mentioned that you get acclimatized to a new environment, you get to know your teachers and instructors. For some of us, we have to figure out how to make the best grades, either ethically or unethically, and we know what happens in our school systems. And seasons of life come with stress. However, when we don't have the ability or the capacity to transition well, then they become disorders for us, like Dr. Denchi was mentioning. Some of the practical steps, I will focus on 3. And this one transitions from whether a person is 2 years old or a person is 70 years old. Number 1, it depends on the kind of problem the person has, or what we in psychology call the presenting concern. Number two, we have to learn to show empathy and not empty platitudes. I feel like in Ghana, all of us in Ghana have a PhD in saying, oh, God will do it. Oh, God will change your situation. I beg you, did God send you a memo that they are going to change the person's situation? Why are you talking for God? And when these things happen, if you don't have anything logical to say, shut up. And then know your limits. If you are not an expert in a particular area, don't speak to it. Many times, all a person wants is just somebody to be there. Instead of, it's like we are afraid to be quiet, so we just have to run our mouths. Instead of just being silent and just using your presence to show that I am here. I am in this with you. I'm not going anywhere. I may be running over Dr. Denchi's own a bit and Dr. Dako's own as well. But when students are in JHS, SHS, university, one of the things that is quite common as we get to feel attracted for either the opposite sex or same sex is broken hearts. And research indicates that when people go through a broken, intimate relationship, they exhibit the symptoms of PTSD and depression. And for some, even if the relationship isn't broken and they just have a crush on people like we've all been before, there's some level of anxiety. We may be using some of these psychological terms, but I want to break it down into everyday language so we can pay attention and figure out how to help our loved ones. When a person is constantly worried, they have irrational fear. So the things that normally you would assume, wait, you are 12 years old. This is not something you should be afraid of. Why do you always behave like this thing is bigger than it is? When that is happening, our normal inclination is to say, man, go away. What's this with you? You're always like the negative person. But again, the second point I made when I started, I said, show empathy. Instead of the natural reaction of being irritated with a person, just swallow a bit, take a pause, and figure out what's happening. Because today it might be the 12-year-old, tomorrow it might be you. There's a story about President Obama's wife when I think she went to college and she wanted to share a room. They had given her a room. She was supposed to share it with a student. And the student was like, there's no way I will share a room with this girl. The person was so mean to Michelle. Michelle became the first lady. And that person lost an opportunity to make a friend. Nobody knows tomorrow. For some people, it's repeated flashbacks. When we go through some life events, we feel like the thing is happening all over again. And that is a symptom of anxiety, depression, and trauma. So many of these things run into each other. That's not the expression I should use. Many of these overlap. Okay, sometimes people perform excessive or repeated, they want to clean. It's nice to be a neat person, but sometimes it goes overboard and everybody, like when somebody sits on your bed, they get up and you immediately want to straighten. When you close a door, you want to check it 2-3 times to make sure, did I close it well? Anytime a loved one is doing something like that, it is not right. And I think if you are not in the psychological profession, this is above you, so you take them for help. When a person has repeated panic attacks, they feel nervous all the time. This is not normal. We all go through stresses. Life can be hard. There have been times this year when I've wanted someone to adopt me because I didn't want to make decisions. It's like, this adulting business is too hard. And that is normal. But it shouldn't be like that all the time. So if I'm going through that all the time, then the people around me should, Hannah, there's something wrong with you. But it comes and it goes because that's life changes. There are some people who just feel they have no interest in life. And like what Dr. Deji was saying, this is out of the norm. So all of a sudden, the person is irritable. They're always sick. It's like, so when every sickness is going, they knock on your door. What is it with you? Instead of being frustrated with them, instead of being impatient with them, take a pause and find out what is going on with you. If you don't have an answer, the Ghana Psychological Association has a whole list of therapists who can help you. Ghana Mental Health Authority has. Many of our hospitals have mental health support that they can give you. When you are working with somebody who generally would laugh at jokes and all that, and all of a sudden they are no longer, it's like, wait, everything annoys you. What's going on with you? They don't have sense of humor. It's like, this thing we talked about last week, and you were the one who was rolling on the floor laughing. All of a sudden, you don't see it as funny. There should be a ding-ding going on. And then I'm coming on to depression. A person feels hopeless and helpless. They are, all of a sudden, they are tearful. You know, they are not in their period. They are not pregnant. They see a child crossing the street, they are crying. Somebody is dead, they are crying, which is normal. They are watching a movie, they are crying. It's like, what is going on with this person? That should give you a ding-ding. We become intolerant of others. We are annoyed with everybody. That's a ding-ding. We don't have the energy to do anything. We are sleeping more or sleeping less. And these are symptoms of depression. What about trauma? When a person has what we call startle response. When we have so many motorbikes, especially in Accra. I don't know about the other regions, but then sometimes they go and they do boom, and many of us will startle. But when you realize that consistently a person is experiencing that startle response, you know that this is a symptom in addition to other symptoms that may be above you if you are not in the psychological field. Please look for help for them. When a person is always on guard, you connect that with being easily startled or frightened, then that is trauma looking you in the face. When people have self-destructive behavior, they're either drinking or drinking too much, smoking or smoking too much, driving too fast. You connect that to the two symptoms, that's trauma knocking on your door. A person does not sleep, or when they sleep, they don't want to get up. That could be anxiety, it could be stress, it could be depression. But when it comes with startle response, being on guard, distracted, you know trauma is saying hello to you. When we struggle to concentrate, if it's out of the norm, you know that these are things that you need psychological support for. I made an asterisk under the burnout. And that's something many of us are feeling a little bit more than normal. So burnout is a form of exhaustion that is caused by constantly feeling swamped. It's like I never finish doing what I have to do. It's prolonged emotional, physical, and mental stress. It is believed that it's related to one's job. But what about those who are students? Technically, their job is studying, and they feel like they can never finish anything. These are all signs and symptoms of what we grapple with. Now that we know these things, what do we do? So if a person has anxiety, you help them do mindful breathing. And mindful breathing has become relatively, maybe because that's my area, I think it's become common. But what we do is we breathe in through our nose in a rhythmic and slow motion, hold the breath a little, and release it through our mouth. We do that 4 or 5 times. What happens is that when we are panicked, fight and flight mode gets activated. So the brain feels like there's danger out there. But when we do this kind of breathing, it floods the brain with oxygen and allows the body to calm down. So I'm going to do, I don't know if you can see my face. I'm going to do 2 of them for those who don't have an idea of what it looks like. And normally we will say, sit with your back in something straight, or stand or lay down in a supine motion and do that. And then I put my hand on my belly so that it goes in up and down when I'm doing the breathing. So I'm taking a deep breath. I encourage this with clients when I'm in sessions with them. If people have gone through traumatic experiences, I would rather they don't close their eyes, because then they get, if we are not careful, they get re-traumatized. But if you do that with a person who is always anxious, always fearful, and is not working, then it means that the person would need psychotherapy. Take them to a psychologist, let them do a whole battery of assessments and provide the appropriate intervention for them. There are some people too, because of the way their brain is wired, they may need medication. So with the psychiatrist doing an assessment, they could probably give them some anti-anxiety medication. And many times we combine these things. I put a question mark along the faith-based narratives because research indicates that religion or faith could either help or harm when it comes to some of these mental health challenges. So depending on where a person is or what the house environment is or what the school environment is, faith could help or harm. You have to use sensitivity. Again, that's where empathy comes in. When a person is going through stress, what you can do immediately is to assess the place of stressor. What's going on? Is it something the person is telling themselves? Is it something that's within the community? Is it something that's happening that's making the person feel stressed? And then connect them to some wholesome support. If it's schoolwork that they are struggling with, could you connect them to maybe a study group to help them? If it's financial, could you make sure they are not wasting the money? Maybe give them some financial advice and help them access some financial resources. And then track how these resources are assessed and used. So you don't just say, oh, go and do this. Follow them, especially if you're a parent or a caregiver. Follow up, work with them, walk through the process with them, and then track it. Hey, how has it been going so far? We did this. What have you been doing about it? I believe in holding people accountable. I'm noticing over and over that in Ghana, people will take or will make a choice and they expect someone else to bear the consequences of their choice. If you want to see an example of that, look at trotro drivers. They will cut in front of you and they assume that the moment they lift their hand, that's it. The next moment they are doing the same thing again. And so they are not bearing the consequences of their choices. And it's not just trotro drivers, it's all of us. Oh, I'm friends with the minister. So all of a sudden, because you dug under my house and my child sank and is dead, so it's okay because you are related to the minister. Let's start holding people accountable. When a person is going through depression, and I showed you some of those signs, psychotherapy is really important. It's so easy for us to say, oh, get over yourself. Oh, kumutrim. It's like you have to toughen up. It's not everything you can toughen up with. And research also indicates that when people are going through depression, if you encourage them and take them through some gratitude exercises, it can help. There are times where you connect them to something to help them take care of, even if it's a plant. It helps them to get over it. You also need them to have, depending on the level of depression, psychiatric assessment and possible medication. When a person is going through trauma or some cognitive challenges, psychotherapeutic assessments are very important because if we don't assess, we won't know what kind of intervention to give. And many times we need a protected environment. Ghana has become so noisy. Depending on the level of decibels from the noise that's happening, it could cause postpartum depression. It could cause ADHD in children. It could cause epilepsy. So I was given a talk in one of these institutions, and we talked about noise, and a lady came and said, you know what, I just don't want to say anything, but I don't know what to do. Many of us, we don't want to be victimized. We don't want anybody to say we are witches, but then they are disturbing us and the cost is too expensive. But in Ghana, nobody wants to speak because we all want to be liked. I guess we have to start saving money so that we can invest in all the medical conditions that can come as a result of this noise. And then when people are going through these cognitive challenges, finding a buddy system helps. Buddy is someone to share your fears with, someone to share your secrets with. I've heard students who say, but doc, we can't trust people. I ask them, do you trust yourself? Can they trust you? Whether a person is trustworthy or not, if people will release your secrets, they will release it. But you got to trust somebody. You can't keep it all in your chest. Otherwise, you would die with it. So these are some of the things that will help. Now, let me go to my children. I've provided this table and I've shared the slides with all of you. So when a child is between 0 to 5 and they have sensitivity to noise, something is happening. Children are loving. Naturally, they will come to you. When you realize they are avoiding contact with others, all of a sudden they are acting shy. Some trauma has happened and you have to probe. And when you are probing, you have to be as gentle as possible. Many times, children do not have the language to describe these things. And then there are times they are so, all of a sudden, they are afraid of being separated from their familiar people. The alarm should ring in your head. When a person is 6 to 12 years old, we have what we call affect dysregulation. We always say that, well, adolescents are moody, but when it's becoming too much of emotional ups and downs, you should take a pause. Unexpected mood changes, learning problems, all of a sudden the child is not doing well in school. You should know something is happening. Late adolescence and adulthood, and this is the era of SHS and university, all of a sudden they are acting out, they are engaging in harmful emotions and behaviors, they are underestimating danger, they are being reckless, like, what's going on with you? Or inappropriate aggression. The least thing you talk about, then they want to fight you. You have to figure out what's going on. Are you paying attention to the people in your life? And are you paying attention to them? And when it comes to children, the best thing for them is play therapy. Play therapy, let me go back a bit. Play therapy is a systematic use of theoretical model that we use in establishing a relationship with a child. So we create this safe environment for them to use toys, and the use of the toys will let you know what's going on. Even if you don't have all the expertise, God has wired children to self-heal. So if they have a safe environment and they get the toys, they will play out whatever they are feeling, and then the healing will come as time goes on. We'll take in any questions that can come in the platform, but this is the end of my presentation. I think I took 3 more minutes extra. So that's about it. Thank you.
Thank you, Prof. That's enough strategies to go by. I personally would definitely go back and take another look at the whole video, which will be shared on YouTube from Monday onwards. So like all our previous programs, you'd find all of them there. That has been a wonderful presentation. I mean, giving us practical strategies to deal with, I mean, what you need to take care of. You should know your limits before even you start. You should show empathy, all that. And before you start, you should understand the problem. And you should look out for the signs and the kind of help you can provide. We'll go back definitely to look at this video again to imbibe it into our system. Let me go. Our fourth presenter, at this point, I would emphatically say he will not be able to join us. So our presenters with us will discuss the issue, and it is that what should institutions do to support students with mental health problems? What should institutions do to support students with mental health problems or concern? Let me go into the chat box and read what is there, then we'll come back. Okay. Chat box. Always place. Ivan Sopoku says, this is fantastic. Godfred says, excellent. Oh, this is helpful. Let's look at the final topic. What should institutions do? Dr. Denchi, should I start with you? What are your thoughts? What should institutions do?
Fine.
With helping
so
students
thank you very
to...
much. So we are talking about. Okay, thank you.
Please go ahead.
Yes. Thank you, Prof. Thank you, Prof. Hannah. I enjoyed your presentation as well as Dr. The name that the student thought it was a white name. So because of that, they came to. That was also good. Okay, so talking about what the institutions should do, the view that the institutions should do what, doctor, you are doing, so to create the awareness. Like I said, usually some of these signs are there, they are visible, but we tend to ignore them or attribute them to set some.
Dr. Denchi, your network, eh?
The network. So I'm talking about creating awareness. So the awareness should be, like I was saying, the students I was talking about. If the awareness had, the institution had created that platform, that awareness, the police wouldn't have been laughing over. Is it okay now?
Yes, it is okay. Please go ahead.
So the students, the colleagues will not have been laughing over it, like you will not come and see you, and then it's been like that throughout. They would have been worried and probably encourage the colleague to see the help of a counselor. So I think that's awareness. And the empathy that Prof. Hannah spoke about is also very important. And we'll get to know all this when we create the awareness. So we should be empathetic towards them. Why will a grown-up like that prefer to fail in an examination? That won't be their wish. So that then I'm also of the view that in most of it, even that our universities are better. But when you go to the secondary schools and our junior highs and then the lower levels where Prof. Hannah said she was going to, where Prof. Hannah also included, you realize that the resources are not there to equip the counselors and the psychologists in the school to be able to work. So the institutions should help in that with that regard. That the counselor doesn't even have an office. The students are complaining about confidentiality, and here is the case: the counselor even doesn't have an office. You go to our SHS, our junior high school, and it's the same staff common room for the counselor and for all staff. So if the institutions will help us by giving the resources, both the human and the material resources, the counselors and the psychologists in the schools can work. In my view, this can help.
Thank you very much.
So that's my.
Thank you very much. Rabbi,
Yeah,
your take on that.
Okay, thank you very much. I think Doc has said it all, but I want to add something to it. I think we should also try to train teachers and lecturers to, do what we call identify and refer, identification of students in distress. You see, they should serve as parents in the classroom, as they usually say, or they usually do. So they'll be able to identify students who are in distress and do the appropriate referral. I think to be given this type of training. Again, there should be comprehensive. There should be a comprehensive counseling system in all our schools. Yes, even in tertiary is doing well, but the senior high is really, really horrible. I know Professor Hannah is doing a good work on that. We had a meeting recently, And looking at senior high school, teachers are doubling as counselors. And this would friends. I think peer counselors in all the institutions, I always advise that even in the senior high schools, they should get peer counseling association, as they have GAMSU, they have PENSA and others. So there should be an association that has, counseling association that can bring more students on board. They will be trained, and these students can be even do referral, identify and refer. And I think these two, when you're able to do that, counseling can go, or psychology can go back to senior high school and travel to the tertiary. So basically, that is what I would have to see on that. There should be more peer counseling program, or we should train more students to be peer counselors to be able to help alleviate the plight. Thank you. I think that's my take for now.
Great. Prof, what's your take on that as well?
I think institutions are overburdened, and that's the truth. So unfortunately, many of us can't think outside the box. So, for example, it's true, when you do visits to senior high schools, many of them don't have counseling officers, but not too far away from them, they have churches. So why can't we liaise with these churches and say, hey, during the school time, you guys don't use your place. Could we use it as counseling? Could we use it as a counseling center for our students? And I like what Dr. Darko said about training peer counselors, because they are with their friends and they can pick up on these things. I visited a university in Kenya, Nairobi, and they had a place where they know that when you come there at this time, you'll find a lot of peer counselors. The peer counselors have been trained in just peripheral assessment. So when their friends come, they know, this one, I can just sit and talk with you. This one, no, you need a professional to help you. I think in Zimbabwe, we have something we call the friendship bench. People will just go and sit there at a certain time, and you know that when I go and I see an old lady, they can just sit and listen to me or talk with me. Many of our people are home, but we don't understand about volunteering system. We have a lot of retired people who are restless and are dying. Again, if a person is struggling with depression, the best you can do is to give them something to do, especially if it's not the kind that needs medication. So why don't we bring some of our retired people on board? If we can just give them transportation or something, this is not money making, just for them to give back to the society. Because when you look at Maslow's hierarchy of needs, you know that a portion of it is about self-actualization. And many times self-actualization means giving back. But everything has become, oh, if you don't pay me, I won't do it. And if you don't pay me, I won't do it. Come on, when we die, we are not taking the money anywhere. So let's think outside the box. There are a lot of organizations who are willing to help. It's not just about the money. It's about making sure a child's negative life trajectory has been turned, knowing that I was able to make a difference in this child's life, so they didn't become a drug addict, but they have become maybe the CEO of MTN. So that's mine.
Thank you very much. Thank you very much. I mean, we've done it. We've done very well with the time. We are only 30 minutes out of it. My facilitators, please allow me to ask our participants to ask a few questions, and we'll be done. So participants, I saw Sadiq, your hand up, and you've dropped it. I don't know whether you are gone. But before, he's back. But okay, let me.
Thank you.
Yes, go ahead. Sadia, go ahead.
And it's all about negative
Sadia,
beliefs.
please start all over again. We could not hear you.
I'm saying that I'm handling an issue of negative beliefs, and it looks like it's about the person thinking that he's offending God and all that. I'm trying so many ways to do cognitive restructuring and so on, but it looks like the person has a lot of comments. What other strategies could I use to help? Thank you.
Thank you for your question. Prof, I'll throw this one at you. Any
Sadia,
ideas?
yes, so I will ask Sadia to connect with any psychologist in her area, because she will need peer supervision so that they can give her the support she needs. This is not the platform to say, do this or do that. You need a peer supervisor or a supervisor to walk you through where has, like, what is it I teach you guys? Like a case conceptualization. Okay, what is the client, where is the client coming from, what's the client's tribe, what's the religion, and then walk them through, and then you do back and forth. What theoretical orientation are you approaching from? What have you used so far? And then they walk you through some of these steps. Okay, try that.
Thank you very much.
Good. So please drop your hand for us. Asabia Elizabeth says, I'm really learning a lot. Please, does gender play a role in these symptoms between male and female? Which symptoms are most prevalent? I'll throw that one to you, Dr. Denchi.
Hello, Doc.
Dr. Denchi, are you there? Yes.
Yes, please. So please come again.
Asabia Elizabeth is asking, does gender play a role in the symptoms? Symptom presentation.
Okay. No, no, I will not say gender plays a role, because we are talking about a deviation from your normal self. So from your personality. So if you are a female, you have your personality. So we are looking at a deviation from what is typical of you. And if you are a male, you have your personality. So we are just looking at what is typical of you, and then the deviation now, and we want to pay attention to them to find out if it's a mental health condition. So I will not necessarily say it differs from male or female, but we are looking at a deviation from your normal self. That's how I want to put it.
Okay, thank you. Prof, let me come back to you.
Let me speak to what Dr. Denchi just talked about. So if it's personality, yes. However, some of these mental disorders differ by gender. So research indicates that women respond to anxiety and trauma differently than men. And so there's a higher ratio of women presenting with anxiety symptoms and depression symptoms than men. However, when you go to attention deficit disorder, the attention, we have hyperactivity and distractibility. Hyperactivity, men report higher hyperactivity and women report higher distractibility. Okay, so it depends on what's happening. The way women are generally wired to be a bit more emotional than men. So anything that affects our emotion, we respond higher to it than the men do. Even with burnout, men respond to aspects of it differently from how women do. And of course, the culture makes a difference, but generally gender does play a role in anxiety and depression.
Okay, thank you very much. Don't go away, Prof. Let me, Dr. Johnny Ando Atta is on. I think that he was supposed to give a full presentation on what we are discussing. What should institutions do to support students? So you can see from his dressing what is happening. So I'll give him a few minutes to wrap it up for us, and we'll see how it goes.
Colleagues, good afternoon. And sorry for being this late. I had to lead my family to a marriage ceremony. One of my family members was marrying, and I had to be the spokesperson for my family. Yeah, so I have spent some time in the ceremony to be with you. But I hope and I believe that my co-panelists have virtually done justice to most of the topics. And I think I joined hearing Prof and Doc giving very insightful presentations, especially on the issue of the gender. Let me quickly touch on that. I think, yes, to some extent, I agree with Dr. Denchi, and also I agree with Prof. But with my work in suicide, depression with men, we realize that the experience, especially of depression, really doesn't differ. It really doesn't differ. However, what differs is the expression of depression. You know, females will usually internalize, you know, the depression, but males will externalize. Males will take to risky behaviors, alcoholism, you know, abuse of partners, and all that. So oftentimes, the assessment instrument that we use for depression usually realize that we don't have most of the male depressive, you know, symptoms that are more externalized. So I think the issue of the experience of depression in particular, it doesn't differ. I mean, males also go through depression episodes, right? But how they express it sometimes, you know, escapes the radar of our assessment tools, standard assessment tools. So I think that when we engage men, we need to be a bit, you know, careful in also looking at how uniquely they present their depressive symptoms. I mean, I always say that mere, you know, risk taking itself could be a sign, right? And so I think that I'll add, you know, my voice on that. But generally, on the topic assigned to me, we are talking about a demographic group, you know, that is really at risk, as we all know from the data. I mean, in Ghana, I work with Center for Suicide and Violence Research, and for the past 15 years, we have systematically gathered data from JSS, secondary school, university students. And in fact, the rates are high. The prevalence rate for both attempts and suicide itself, and even ideation are high. And so for me, my main point I want to stress is the fact that we need to create, you know, community cultures in our schools. We need to create community cultures in our school. What do I mean by that? We have had several cases where students go to school and they don't want to go again, even at the at the basic level. You know, from the kindergarten, primary, we have students who go to school, and because of bullying, victimization, because of maybe some teachers who are not so empathetic, because of certain teaching styles, they do not even feel, you know, safe in these schools. So for me, we need to create safe communities in our schools. And what do I mean by that? We are looking at a community in a school where students will feel safe to open up about anything they are going through. They should be able to believe in their teachers and open up to them on anything that is really stressing them. Again, we have had cases where that sometimes students go and open up, you know, to teachers on something like suicidal ideation. And often what comes out is something of stigma punishment, right? You know, this will rather aggravate the student, you know, problem. So whilst we are creating safe schools, one of the things we can also be assured of getting is that when students feel that they have a community in a school, in fact, research is telling us that students who are in schools with high sense of community, right, they are more likely to be academically motivated, right? Again, they are also more likely to avoid problem behaviors. They are more likely to develop social emotional skills, right? Such students are more likely to open up, okay, for help, right? So I believe that this is very important. And if it doesn't count only, we need to consciously create it. And we can consciously create it when the church in the school, the staff in the school are themselves, I mean, very literate as far as mental health is concerned. So then we need to also increase mental health literacy for the teachers in the school. In fact, the prof said something when I joined. Our teachers are overburdened. In fact, I spent about the last 3 months going to schools. I mean, secondary schools. Yes, just last week I was at Yasantua. The sheer numbers of the students in our schools, my brothers, my sisters, it is not easy for our teachers to handle. And oftentimes, teachers are not getting what it takes to be able to effectively really monitor, parent our teachers for our students for us. So for most of them, they more or less are laid back. Only a few who are so committed are the ones who are empathetic enough, right, and to be present in the situations of the students. So they are overburdened. And so I think that I align with what Prof said. What we can do is that let's just create peer counseling, you know, teams. I have adopted that here at the University of Ghana, where I have created, you know, a team of students because I get overwhelmed with the cases. So now I am more or less training the students themselves with some of these basic mental health skills, psychological first aid, and they are really doing great. Friends, there are quite a lot of talent, a lot of resources in our students, from the JSS secondary school to the universities. There are quite a lot of resources in them. Oftentimes, they do not have the avenues to channel these resources. And so I think when we work together with the schools, equip them themselves with the mental health literacy, and also help them with the necessary skills they need, I think that then they will also be able to train quite a few of these students, right, become mental health or peer counselors, who can then supplement the work they can do. One other thing that I think we also need to look as institutions when we are helping our young students as far as mental health is concerned, for me, is the fact that we need to understand the students we have today. There's a generational gap. There's a generational gap. And their situations are unique from when we were students. And so we should not be overly judgmental. We should draw them to ourselves. Are just overwhelming. And so they all need help to be able to, help our students in our various schools. Thank you so much, Prof. Doc, just a little I will add to what has been said already.
Thank you very much. I mean, I can the desire to come in and deliver your bit. Meanwhile, you have to go and get one family member married. So, of course, that's quite stressful for you, understand, but all the same, we appreciate that you're able to steal some time to come in to talk to us a bit. So
Thank you so much.
That's fine. We appreciate that. Almost 4 minutes to 2 o'clock, way out of time. So at this point, we would have to. In fact, we've had quite some interesting points here. What are some of the things that stresses our children and our students? Academic expectations, financial difficulties, social life and relationships, addiction, which includes betting, masturbation, internet use, self-discovery, lack of resilience, and most importantly, time management. All these are things that really stresses them out and it progresses into mental health difficulties for them. And Dr. Denji gives us a signal that some signs that we can pick out includes weight issues, social withdrawal, loss of interest in activities that hitherto was exciting for them, difficulty concentrating and focusing, emotional outbursts, changes in appearance, taking risky behaviors, hopelessness and helplessness. All these are issues that they exhibit. In fact, overall, if they exhibit persistent changes in their thoughts, behavior, and feelings, that's a cause of reason. I don't know who is Clinical Psychology Center, but he has raised his hand, so let me give him the chance to ask his question, then I would continue. Clinical Psychology Center, please identify yourself well, unmute yourself and ask your question quickly, please.
Okay, good afternoon, Doc. Yeah, someone here, we are all listening. So someone here wanted to know.
And please identify yourself well. And where is this center? Your line is very bad. I may have to.
Hello. So, can you hear me?
Yes, but it's not that clear.
Okay. I'll
I'm sorry, I would have to mute you, then I'll go on with my summary. So like I was saying, so she gave a lot of signs that we'll look out for and use that as the stepping stone to supporting and assisting them to avert the crisis. And Prof give us that practical, before you start, you should have some practical strategies that you need to know and have an understanding of the issue, know your limits, and be empathetic. If you don't have this, then don't go near it. You don't have any business going near it. Go straight to the professional. And we need to look out for signs for anxiety, stress, depression, and trauma, and all that. And the others, professionals take care of them. Mindful breathing, you need to learn how to do it. Psychotherapy, medication, and all that. These are jobs for the professionals. And she said that, which I've always said it. Ghana Psychology Council have a whole list of professionals they're ready to support. Have a look. And even currently, you can chat with them behind the scenes and take their contacts, and they were ready to support you. What institutions can do? A whole lot of ideas have come up. Overall, we should intensify mental health literacy in the school so that the students would know and be able to be supportive to each other. We can employ peer counseling. And again, Prof even said that we could bring in pensioners who are professionals to come in as volunteers to support. Dr. Ando also came in so that we could make the environment very friendly so that the students would open and talk friendly about it. In fact, this has been very worthy, very worthy. And there is a recording which will be live on YouTube from Monday on. Somebody did ask me, hey, you're on my phone actually, and said that, where am I holidaying? And I said it's a coded place. On that note, let me see what I will do here. I'm changing my background. I've changed my background to a Christmas background. Tomorrow is 1st December. So let me thank all our facilitators for the wonderful job and the wonderful knowledge, wonderful explanation that they've given to us. We really, really appreciate it. For our participants, this is the final one for the year. You've always attended. I want to say thank you on behalf of the Chief Executive of Mental Health Authority, on behalf of all staff of Mental Health Authority who are listening now, that you've been there, you come to participate. And we know that the knowledge that you get here, we share it with others. And we really want to thank you so much for that. On that note, since it's our final one, and I've changed my background to Christmas, I want to wish all of us a Merry Christmas, prosperous New Year. We will see each other, God willing, next year in good health with equally exciting topics. So Professor Akwe, Hannah Akwe, Dr. Lydia Denchi, Rabbi Dampa, thank you, state facilitators, Dr. Johnny Ando Atta, thank you, and my able participants, thank you so much. On that note, have a Merry Christmas and an exciting New Year. We will see each other again. Thank you very much.
Thank you, Doc. Thank you, Doc. I just want to make a disclaimer. I'm Rabbi. I'm yet. Maybe I'm not doctor now.
Everybody's calling you doctor.
Yes. Maybe in the near future. Very soon I'll be a doctor. So thank you very much.
This is a warm up to it. We are already pushing you.
Sure. Maybe very soon.
You, motivating you to get there.
Thank you. Grateful.
Motivating you to get there.
Grateful.
So all of us, let's have a Merry Christmas. Let's be health conscious. Memuna, please mute yourself.
Thank you, Doc. Thank you. Sorry.
Thank you very much, Doctor.
Thank you very much for the presentation.
Dr. Ernest, thank you for joining.
Thank you too.
Thank you all. Wonderful speakers.
Bye-bye. Where was the chat?
Bye.
Bye-bye, everyone. Oh, Rita, thank you for coming. Prince Bachi, thank you for coming. Rich Love, thank you for coming.
Please,
Psychologist Sandra Thompson, thank you for coming. Dr. Thompson, thank you for coming. You are all hiding in the background. Oh my goodness.
please, Doc. Please, Doc, what is the name of the YouTube channel?
Oh, just type in the title. Just type in the title of this program.
Okay, Mental Health Authority.
Just type in MHA webinar. This is the 26th one that we've done. So when you type in MHA webinar, it will all pop up. Okay. Dominica, it's nice to see that you attended. Thank you for coming. Let's all have a very good.
Doc, it's nice. It's nice here.
Yes. SCA, thank you for coming. Benedictus, thank you for coming. Dr. Thompson, thank you for coming.
Won't you thank me
Mary
for coming?
Mary Utuma, thank you for coming. Hey, Akosia, thank you for coming. Israela, thank you.
So won't you thank me for coming?
I don't know that your name is phone. I identify people by their names, please. So if I don't see the clear name, how do I know it's you for me to thank you? So write your full name that I know who you are. Kate, thank you for coming. Bye-bye for now. Have a Merry Christmas and Happy New Year.